Well, hello, ladies and gentlemen. Woo! It is finally time to introduce you to the one and only Medi 101 podcast. And thank you for attending the premiere. Big round of applause to you by me and me only, since I still don't know how sound effects work. Anyways, let's be cracking on with this episode and the theme about this episode. And what it really is a question of why should I bother going into medicine, biomedicine, compared to, let's say, other careers that could involve engineering or anything like that. Just the courses that take a lot less time and a lot less experience to get great money and not much liability and not much shoulder and the weight of bearing the deaths of people and their lives and families. All of that nonsense, right, that affects your pocket and your mood. I mean, it just doesn't seem like medicine is really worth it. But before we get started onto what is medicine, let me introduce myself. I feel a little rude, quite rude. I'm just a random guy talking to you, okay? Most of you may already know me. Hi, my name is Vincent Kushkov. I am an A-level student at Torquay Academy who at the moment is curious about medicine. And I want to know a little more about that subject, about that topic. I want to grasp it. I want to see all my different paths and careers, and I want to see if it's worth going into it for a long time, because this is a job that you have to really commit to once you're into it. And I'm a little scared about some things, and I want to know what's the pay like, what's the research like, what will I get to do if I was a podiatrist or dietologist, or what would the world of neurosurgery look like in 10 years, okay? Simple things like that we want to start debating and talking about. And this podcast is for those who also have maybe a slight interest in medicine, or maybe a lot, and they just want to top up on their knowledge and they want to understand, okay, I know what holistic care is, and I know what the difference between biomedicine and medicine is, and I know how the communications work between the doctors and all the different digital IT systems they use to make sure that the prescription's sent through and everything and all that. You just got a little bit of interest into this topic, or a lot of interest, and you're very welcome to listen on to the show, because I'm trying to also inform people with the latest updates on the NHS. Why they right, why not? But anyways, I'm talking too much, aren't I? And I'm not talking about the main topic of this episode. Why medicine and biomedicine? Well, what's medicine, really? What is it? Have a think about it. What is medicine? It's a simple question, right? But obviously it's not. But the actual answer is, it damn well is. Medicine is just the science or practice of the diagnosis, treatment and prevention of disease, as stolen and nicked from the Oxford Dictionary. Thank you very much, Oxford, for creating that beast of a book. Anyways, so now we know that medicine is about treating people, understanding what causes their disease and preventing it from happening ever again. We gotta understand, okay, that's cool and all, but what are those three extra letters some dumb idiot decided to add on the end of medicine? The B, the I, the O. Biomedicine, right? What is that? And that's a very interesting question, because even I didn't know what biomedicine was until today. And let me enlighten you with the Oxford Dictionary version of it. So to answer that question, it's also very simple. Well, I'm glad you asked. It's this subspecialty of medicine where we take a lot of what we already know from our sciences and do a lot of research, do a lot of subspecialization, and just try and understand the different methods in which we can treat our illnesses and find new ways to diagnose them. And that could involve mass different areas of biomedicine. For example, genes and DNA, the newer, sexier version of biomedicine that everyone wants to go into. We want to see how let's say this sequence in your DNA is going to prevent cancer, and how we can perhaps implement that through medicine and see who's vulnerable to certain diseases. And there's also immunology as well. So that's the study of how the disease spreads, where it lives, how we can perhaps look at getting rid of those environments that cause for there to be such a high outbreak of this disease, and looking at the more scientific part of life that just is quite boring if you don't want to talk to people as much. But if you work in a lab or you want to do something that's working in a small team and still earning a stupidly alright amount of money when you become a senior doctor, then yeah, go specialise, study the new stuff, understand that, get into an area that you truly love, and I mean truly love. Because, for example, there is this biomedical course called histopathology, which is a sub branch of pathology, which is the degree where you study diseases, how they're spread, and all sort of that malarkey. And anyways, histopathology is one of the sub branches of pathology, and in histopathology, it's really a lot of lab work. Like, for example, the everyday lifestyle of a consultant histopathologist can involve taking some slides, looking them under a microscope, literally just looking it under a light microscope, comparing it to diseases we already know. And for example, if it's a particular type of cancer, do we want to know if it's malignant or benign? We can look at all sorts of things under that microscope, and the histopathologist makes sure that that disease could either not be spreading anymore, or that cancer could not be spreading anymore. We're making sure that a surgeon has done their surgery successfully, so we can look at tissue samples under a slide to make sure that, you know, we've got a few healthy cells taken away when we were taking that cancer out, and that we haven't just missed out a bit of cancer that's going to eventually spread out. Or maybe we'll want to see what other diseases this person may have that could have caused a type of death. And we just look at the cells, prepare them. And with histopathology, for example, you get to prepare a lot of microscopic slides every day. It's a 9 to 5 job. It's quite secure. There's barely any overtime hours in some laboratories if it's not urgent cases, and you can really live a relaxed lifestyle and still earn a sizable income that you might be happy with. And for some people, that's not really interesting, is it? Sitting in a lab all day, just looking at microscope slides over and over. But the thing is, these areas in biomedicine, they always have research going on. You'll always be studying something alongside what you're doing as your job. And it could be looking at how different medicines work, for example, with tissue slides, or and to some people like myself, that's not really exciting, right? I would like to research into certain areas, but I don't really want to be looking under a microscope every day. And that might be you, or that might not be you. Maybe you like looking at these sort of things, because really, a difference between medicine and biomedicine is, with biomedicine, you don't exactly get much patient-to-patient contact. It's not immediate treatment for most of the cases. And with medicine, you really get to see the outcome of what you've done, right? What you've actively done to improve the health and well-being of individual patients, right? Through that hands-on care approach. And even if you are in medicine, you don't even have to have a hands-on medicine approach. It's all really up to you, because there's so many branches of medicine and biomedicine you could talk about. It's really tailored up to you. But one is really, well, medicine is really a lot more about looking at individual patients and consulting with them, seeing how we can treat their diseases. And biomedicine is just improving healthcare and making sure that everything is going all right in the NHS, for example, in the hospital, and people are doing that what they're supposed to. And you can also find, let's say, if you're related to someone with ancestry tests, which biomedicine, you get to do that. which I think that's pretty cool. Whereas medicine, you get to sometimes see, oh, did you hear about that baby in Senile ward? Yeah, it died, mate. And it's a lot more tragic. So that's one reason for why you shouldn't go into medicine, but should go into biomedicine, is that with medicine you will create relationships with people a lot more easier that aren't in your work environment. They're not your colleagues, but rather they're your patients, and that has a burden upon your shoulders every day. And people love that, because to treat someone and to see their conditions say go a lot better, and that little thank you that someone might say in the end, or praise be God, or anything of that sort, that's the reason that a lot of the people in our NHS and private clinics, is that they love that. They love that. It's like being a parent, and it takes a lot of time and commitment to be a parent. And biomedicine, well, you can start a family easier, and you can live your life without much worries other than perhaps deadlines or equipment and budgets. But that's basically the admin's job. We don't have to worry much about that. And now I want to really make you ask yourself, okay, why do I want to go into medicine? Or why do I want to go into biomedicine? Why don't I want to go for another or the other? I don't know. This is where you can do your own research. This is where you can focus really in on yourself, because both jobs are very career dedicated. Like once you're into medicine or biomedicine, yes, you can change between the different medicines and whatnot in that area, but it really, you just have to ask yourself why I want to commit my whole life to the medical environment. And that's what it will be. You will be committing your whole life to this medical environment, and that's why some people just can't handle that stress. And you get to see some junior doctors dropping from the NHS, or lab technicians who just get quite depressed because they don't have much social contact and they struggle with person-to-person communication. It's the same thing with medical workers, is that they have to deal with the copes of the patient. They share some of that emotional burden onto themselves, and they carry it every day. So why would you get into medicine? For me, I'm going to just throw a few points at you, and this is like the most boring cliche ever. Everyone's heard this, but it's the enjoyment of helping someone else get better and letting them live on with their life, seeing that face, that happiness, that hope in someone's eyes, and saying to themselves, yes, you've got a chance. Or sometimes it's about being able to have those tough conversations with a patient and just comfort them at that moment, to tell them about something completely life-changing, whether or not it's involving death or permanent paralysis or hefty, annoying treatment that no one likes to do, like dialysis, which is where your kidneys have shut down and you've got to go through machines or like bags and surgeries just to keep you alive until they can get you either a replacement kidney or fix your kidneys. All of that I personally enjoy. So it's a bit like a TV drama, let's say. And if you're into helping people, you get to see that happen. And those who don't help from, you learn from, and you contemplate about that. And it's really interesting to me. I don't know why, it just really is. And so another key reason for me is the flexibility of the job. It usually can involve seeing some of the same old cases again and again, but with the developments of new medicine that biomedicine really gets into and pharmaceuticals get into, you get to offer new treatments and look at how maybe we can do a different procedure on this patient, and maybe this type of surgery is outdated. Let's use the new Da Vinci robots to make sure we don't have as much blood loss or risk of infection. It's all these different aspects of the job that allow you to play around and find out what cool methods work and what cool methods don't. I'm not saying, right, do any human testing. That's a big no-no. I condone that, and so should you, hopefully. I'm saying that because I don't know my audience yet, and so yeah, there's a lot of flexibility to the job. And another point, I'm just going to make a final point since no one likes listening to my voice, let's be honest. But I bet what gets your ears pricked up is this thing called money. Yeah, it's quite good. It's considerably increasing, thank goodness, and some junior doctors still don't get paid enough to have a living wage. You're expected to have around £29,300 to £32,300 when you're a junior doctor for your first year, and that goes up to £40,000. Then that just increases and keeps increasing, and there's a lot of these so-called things called opportunities, and the opportunity to just specialise in a career, earn more money. Everyone loves that, but let's be honest. Hopefully you can just live out your life progressing throughout your career, and that's another cool aspect of medicine, is it can keep progressing. And yeah, that's why medicine is pretty cool, guys. There's three things: money, flexibility, and also how cool it is to help some people, right? And you get to be called doctor. Who does not want to be called doctor, right? For me, Dr. Kushkov sounds like a super villain name. I mean, come on, Dr. Kushkov. That's got a ring to it. Let's say you're John Smith. Oh, how boring. Dr. Smith. Now that's respectable. That's a title right there. Right? Comes with their perks. But anyways, now we got to talk about why people choose biomedicine. Okay, let's get into that. Right? I mean, this is the point of this episode today. And hey, there's a lot of lab work they get to do. Some people, when they get in that lab, it's their zen zone, man. You feel me? And you can get into a real nice flow of work that you can control. It's got a rhythm to it. People can easily follow that through. There's a lot of thinking behind it, but a lot of the times stuff can make sense, and you get to be a lot more creative in a lab than you do with dealing with patients. I mean, you're not going to practice new medications onto a patient without their consent. But with biomedicine, for example, you could just use HeLa cells to test whether or not this medication of cancer or antibiotic is more potent than the last generation. And then you can earn a stupid amount of money from that when you want to go into private pharmacology. There's also B, right? It's quite quiet, just to be able to almost sit down at an office sometimes or get around doing these sort of things, and you just get to not have people bother you. Yeah, if you're into people not bothering you, this is the sort of profession you want to get into, because there's new stuff happening always. There's a lot of thoughts going on, and when you do want to talk to people, you've always got someone by you, and these people will be your lifelong friends. A lot of the people get to understand each other quite close and quite deeply, because you don't really get a lot of new people in labs, and you stick with what you have, from what I've gathered so far, and you're happy with your own little community there, and you get to establish yourself and your own name amongst the field, since it could be a branch that no one's really doing much of research in or any work in, and then you get to be mad popular in something specific, such as the pathology of foot diseases. For some reason, I don't know why you might be into foot diseases, but you could just be the top dog expert for that, and everyone who's got a manky ass foot disease can come to you and be like, gotcha buddy, I know what to give you. Right? That's pretty cool. And just one final note, I think I might continue this episode next week because I'm ill, and it's not good, bro. It's not good. Feeling a little bit cold myself. I should go see the NHS, but who cares, man? Who cares? What else? Please feel free to leave constructive criticism. I know this is a boring episode, and I intend to add cool little videos or better commentary, because this is quite boring. I've just listened through it myself, and honestly, I just had a beautiful nap. And I hope you at least gathered some useful information from it. I know I did. And if you've got any questions, also feel free to just leave them down. Alright, thank you very much. Take care. Enjoy your life. I hope it's successful. And see you soon.